Deadly Heart Trek is a bunch of committed individuals jumping in the back of a four-wheel drive, visiting remote communities, working together with them to provide skin checks, heart checks and education to empower them to address rheumatic heart disease and skin health in their community.
So rheumatic heart disease starts from the strep germ. This germ lives in our throat and on our skin. When children are exposed to these germs repeatedly, then it creates an autoimmune reaction which leads to damage to the heart valves.
Rheumatic fever and rheumatic heart disease are diseases of disadvantage. This disease has not gone away.
We have a large population of Indigenous Australians living in these remote areas that don't have the same access to healthcare that other children around Australia would have.
The consequences of damage to heart valves during that period of time can be absolutely dire.
We're seeing children with more advanced disease, children who need heart surgery at the age of 5 or 6 or 7 years of age.
With the ultrasound scans, we can detect really early rheumatic heart disease, and when children go on treatment at that stage, there's a chance of reversing the heart damage altogether. So we listen to communities, families, to see how we can work together to really put this disease in the history books.
Look, I'd love to see them travel the whole country, and test all of our mob.
We have the highest rates of rheumatic heart disease in the world, and we don't have a coordinated effort in place yet to address that need.
And that would be completely unacceptable in most communities. It would be page one news. No one would accept it. And yet, we seem to accept that this continues to happen in Aboriginal people. We are sick of this disease. Communities, parents, kids are sick of this disease.
Take it seriously, please. We've got young children that are dying from this disease that's been prevented in every other developed country.
This can be achieved, this is doable. All we need is political will to fund projects like this and work on delivering what we know works.
For goodness sake, you only got one heart. Something happens to that, you've got nothing.